morning, ma'am. I'm Shawata Chulsi, your student nurse for the day. And today I will be doing an assessment on the neurologic, musculoskeletal, and peripheral vascular system. So the number one procedure is to identify the patient. Is it okay if I'm going to touch your hand to check for your wristband? Okay. Okay, and after that, you must explain the procedure to the patient. So, ma'am, I'm Shawata Chulsi, your student nurse for today, and today I will be doing an neurological, musculoskeletal, and peripheral vascular assessment. So, just relax. Okay, so can I help you to empty your bladder first? Okay, let's go. Okay, and after that, you must perform hand hygiene and help the patient to undress and provide a patient gown if needed. So, ma'am, have the patient gown here. So, ma'am, let's go there for me to help you to undress. Okay? Okay. And after that, you must assist the patient to a sitting position and observe the overall hygiene and physical appearance. Now, we're gonna assess the patient's mental status. So now I'm going to ask you some questions. Some of it may be easy and some of it may be hard. For example, how old are you, ma'am?
I'm 13.
Okay. Do you know where you're at today?
Yes, I'm at Bulano, City, Calamba.
Okay. And today is?
Tuesday,
Okay. And the month is?
August.
Okay, very good. I'm going to tell you 3 things that you need to remember. And I will be asking them later to you, okay? So now repeat after I say this one. Namjook,
Namjoon,
Korea,
Korea,
puppy dog.
puppy dog.
So I will be asking that later. So can you read this one?
Right later.
Okay. Can you write this one? Okay. You are very beautiful. Okay, very good. Can you show me your right little finger? Okay. This one's a little hard, so take your time. You must say 3 cities, 3 colors, and 3 vegetables. So, 3 cities,
Baguio City, Tuguegarao City, and Tabuk City.
3 color,
Green, purple, white.
3 vegetables.
Carrot, potato, broccoli.
Okay, you did great. Okay, can you spell the word backward?
BNROW.
Okay. What were those 3 things that I asked you to remember?
Namjoon, Korea, puppy dog.
Okay, very good. Thank you very much. So, let's go. Close your eyes. Okay.
And smell vanilla.
Okay, so that's vanilla and that's correct. Okay, good. Okay, now we're gonna test for the visual acuity using a Snellen's chart. And to do that, you must have the patient stand back 20 feet away from the chart. So, ma'am, can you stand? Okay. So what I'm gonna have you to do is to look at the chart over there and read the lowest line for me, okay? And so first you're gonna cover up your right eye, then your left eye, and we'll do both on the same eyes. So, okay? First, cover up your right eye. Okay? Read the lowest line for me in the chart. Okay?
EDFCZP.
Okay, line 8. And cover up your left eye and do the same thing again. And let me know if what line can you read.
DEFPOTEC.
Okay, the line 8. And read again with both eyes.
DEFPOTEC.
Okay, so she reads from line 8, and that means she has 20 over 20 vision, and that means that she can see the same of the letters at the 20 feet that a person with a normal vision can see at 20 feet. However, her left eye, he could only read like line 6, which is 20 over 30. That would mean that his left eye sees at 20 that a person with a normal vision would see at. Look at the object. Okay, they both constricted. First, we're gonna be looking at the involuntary shaking of the eye, and how we're gonna do that is to have your pen light, and hold it 12 to 14 inches away from the patient's nose. And what I want you to do is to keep your head still and don't move. Just use your eyes to follow the movement of this pen light. So let's go. So as you're doing this, you must do it in the 6 cardinal field of gaze, and just move your pen light and look for any involuntary shaking of the eyes. So, okay. Okay. Next, you must look for the facial features such as the wrinkles of the forehead, the nasolabial folds. So I want you to close your lips tightly. Okay. Okay, good. Can you open your mouth? Show me your teeth. Puff out your cheeks, please. Whisper 2 words on the other side. I will occlude your right ear, and you need to tell me what I said, okay? So I will occlude your ear and
Apple, banana.
okay. So now I will occlude her left ear and whisper.
Apple, banana.
Okay, thank you. Okay, and I will just poke a little bit there to elicit a gag reply with the use of my cotton applicator.
Ah.
Okay, there you go. So I'm just gonna be looking at the overall skin color. So the skin is smooth and has an even color. And I don't see any discolorations. So in the temperature, the skin is nice and warm. So in the texture, everything is nice and smooth. And I don't see any signs of edema.
Anak, slipper ka pa.
Okay, and that's a good sign of elastic trigger. So now we do the active range of motion. So ma'am, can I have your hand to take your elbows like this? Our hands like this. And take it in a circle like this. Okay. Your elbows up and down like that. Your wrists up and down, side to side. Okay. Your fingers, take them out like this. Make a fist. Okay. And that's an active full range of motion. So, assess the passive range of motion. So, ma'am, can you sit? So, I'm gonna do the passive range of motion to feel for crepitus. Okay. Okay. Okay, on the other side. Okay. everything is intact, non-tender, no crepitus or anything like that. So in the neck, I'm gonna have you to bend your head forward. Okay, tip it all the way back, forward. Okay, side to side. Okay, can you twist your head, ma'am? Okay. Okay, and can you look at this way, ma'am? Okay, that way po. Okay, very good. And now that we've done the active range of motion and the passive range of motion, we're gonna do the muscle strength. So, okay, so now we're gonna inspect and palpate the hands, the wrists, the fingers, elbows, joints. So now, let's palpate. Okay. Okay. Now palpate the radial and the brachial pulse. Okay. So now we're done with the active range of motion, passive range of motion. So now let's go to the muscle strength. So I want you to, mom, is to hold your arms like this. Okay, and I'm going to push and you push towards me, okay? Okay. I'm going to do this. Pull towards yourself, mom. Okay, then pinch my fingers for grip. Okay, so your muscle strength is 5 out of 5. Now the next is we're going to ask the patients to close their eyes, and using my finger I will write a one-digit number to the patient's palm and ask him or her to identify the number that I have written. So you must do it in both hands. Okay, ma'am? Can you close your eyes, please? Okay, maybe your tongue. Okay, identify once I have written this number. Okay. 2. Okay, good. This one. 1. Okay, very good. And after that, you must ask the patient again to close their eyes, and you must put a familiar object on the patient palm and ask them to identify it for you. So now, can you close your eyes, please? Okay. Give me your palm, ma'am. Okay. Can you identify this, ma'am? Cotton. Okay, very good. And this is cotton, so this one, the other hand. Okay, very good. So we're gonna assess the lower extremities. So we're gonna position the patient to a supine position. Okay, so now I will be examining and inspecting the legs, the lower extremities. So now the legs is nice and symmetrical, and there's no any sign of deformities. All the skin is even in color, and I don't see any discolorations. I see a little knee bump right there, and the skin is smooth and non-tender. The temperature, it is nice and warm. And I'm palpating for edema because the edema is very common in the legs and the foot. Okay. So as you see, there is no sign of edema. And now I'm gonna be looking at the skin turgor. Okay, so that's a very good sign of elastic skin turgor. So now, mom, can I have your legs to kick up? So after that, we're gonna ask the patient to stand straight one leg at a time. So mom, can you stand with your one leg? Okay. Okay. Okay, good. On the other side. We are doing this to test for the balance. Okay. And after that, you must ask the patient to move one leg laterally with the knee straight to test abduction, and medially to test the abduction of the hips. So now. Okay. Now, mom, can you move your leg laterally? Okay, medially. Okay. The other one. Okay. Okay, as you see, she has done that with. So now we're going to test the muscle strength of the lower extremities. Okay, so now we're going to test the muscle strength of the patient. So, ma'am, can you raise your thigh against my hand? Okay, good. Patient to push outwards against the resistance of my hand and pull backwards against the resistance of my hand. Okay. Now can you push, ma'am? Okay, that was strong. Okay, put it, put up your feet. Okay, good. And after that, you must do it on the opposite side. But I have already done it with the both feet, so that's okay. So now we're gonna assess the deep tendon reflexes. So the number one procedure is to place your fingers above the patient's wrist and tap with a reflex hammer. So I don't have a reflex hammer, so I will just use a comb to percuss on that side, and after that, repeat. You must repeat it on the other side. See? Okay, on the other side. After that, you must place your finger over the antecubital area and tap with a reflex hammer. So this is the antecubital area, and I will put my hand. Okay. You and in doing this, you must do it also in on the other side. So what we are looking for here is the constriction of the bicep and the flexion of the forearm. So there you go. That's a little bit of response. And the other side. Okay. And after that, you must place your finger again on the triceps tendon area and tap with a reflex hammer. So I will just use my fist. So this is the triceps tendon area. This one. And I will tap here. So that's a very good response, and you must do it on the other side. So after you're done, below the patella with a reflex hammer, and also you must repeat it on the other side. Okay. Okay. So after that, you must tap the patella with a reflex hammer and also do it on the other side. So this is the patella, and I will just use my hand to tap here. And we are looking for a response. So, okay, that's a very good response. The other side. We do it again. Okay. Okay, good. Okay, so now we're gonna tap the Achilles tendon with a reflex hammer. So by doing that, you're gonna hold the feet like this, a dorsiflex, and what we are looking for here is the feet to do the plantar flexion. So it should go down like this while you are tapping the Achilles tendon. So hold the feet like dorsiflex. Oh. Oh. Okay, so that's a good response, and we'll do it again on the other side. Okay, good. And now what we're gonna do now is to stroke the sole of the patient's foot with the end of a reflex hammer or other hard object such as key, and repeat it on the other side. So after that, you must ask the patient to dorsiflex and plantar flex against the resistance of your hand. So, okay. So, ma'am, can you dorsiflex against my hand? Okay, good. Okay, good. And after that, you must observe the patient as she walks with a regular gait. So, ma'am, can you walk please? Okay, good. And can you walk on your toes? Okay, good. On your heels? Okay, good. Heels to toe, ma'am? Okay, good. And after that, you must perform the wrong bridge test to the patient and you must ask them to stand straight with their eyes closed and their arms at the side. What we are looking for here is a positive verb bridge test because when the patients have closed their eyes, some of them is unsteady and they may fall and that signifies a low joint position. So after that, you must assist the patient to a comfortable position. So mom, it's done now, okay? And do you want to sit or stand po? Okay, so do you want to sleep or you sit, ma'am? Sit. Okay, sit. Okay. And after that, you must perform hand hygiene.